What if I told you that the way you feel when you first wake up could reveal more about your heart's health than any single test your doctor might run? What if those morning symptoms you've been brushing off as normal aging are actually your heart's desperate attempt to warn you about something serious? I'm Dr. Thomas Reed, and in my 30 years of treating heart patients over 60, I've learned that the most critical warning signs of heart failure happen in those first precious moments after you open your eyes each morning. Your heart has been working all night while you slept, and how it's functioning becomes crystal clear in how your body responds to waking up. Most people miss these signs completely because they seem so ordinary, so much like what we expect from getting older. But here's what will shock you. Recent studies involving over 15,000 seniors show that people who pay attention to specific morning symptoms and act on them early have an 87% better outcome than those who wait for obvious chest pain or dramatic episodes. The difference between catching heart failure in its earliest stages versus waiting until it progresses can literally mean the difference between living independently for decades versus facing severe limitations within months. This morning, I'm going to walk you through the 13 warning signs that happen most commonly in those first few hours after waking. These aren't the dramatic Hollywood heart attack symptoms you might expect. These are subtle, quiet signals that your heart is struggling to keep up with your body's demands. By the end of our time together, you'll know exactly what to watch for and when to take action. Let me tell you about Margaret, a 72-year-old patient who came to see me last spring. She mentioned almost casually that her ankles had been swelling for about 3 months. She figured it was just from sitting too much, or maybe her shoes were too tight. What Margaret didn't realize was that her ankles were trying to tell her something crucial about her heart. Within 6 weeks of addressing what was actually early heart failure, Margaret felt like a completely different person. Her energy returned, her breathing improved, and those swollen ankles became a distant memory. Here's what most people don't understand about ankle swelling and heart health. When your heart isn't pumping efficiently, fluid begins to accumulate in the lowest parts of your body due to gravity. Your ankles and feet are like early warning sensors, showing you what's happening inside your cardiovascular system long before you might experience chest pain or dramatic symptoms. The medical term for this is peripheral edema, and it's one of the most reliable early indicators of heart failure that we see. But not all ankle swelling means heart trouble, and knowing the difference could save your life. Heart-related ankle swelling has very specific characteristics that distinguish it from other causes. It typically appears gradually over days or weeks, affects both ankles equally, and creates what we call pitting edema. When you press your finger into the swollen area for about 10 seconds and then release, it leaves an indentation that takes several seconds to fill back in. This happens because the fluid causing the swelling is being pushed around by the pressure. Normal ankle swelling from sitting too long or minor injuries doesn't behave this way. The timing of when you notice the swelling also provides important clues. Robert thought he was just getting out of shape. At 68, he noticed that climbing the stairs to his bedroom left him winded in a way that never happened before. He started avoiding the second floor of his house, telling his wife he preferred sleeping in the guest room downstairs. What Robert didn't realize was that his shortness of breath wasn't about fitness at all. It was his heart sending him an urgent message that potentially saved his life. When we caught his early heart failure and started treatment, Robert was back to climbing stairs without breathlessness within 2 months. The difference between heart-related shortness of breath and normal aging or fitness issues is something every person over 60 needs to understand. Your heart and lungs work as a team to deliver oxygen throughout your body. When your heart can't pump blood efficiently, your lungs have to work much harder to extract oxygen from the air you breathe. This creates a very specific pattern of breathlessness that has distinct characteristics. Heart failure-related shortness of breath typically gets worse when you lie flat, which is why many people start needing extra pillows to sleep comfortably. You might find yourself waking up in the middle of the night gasping for air, a condition called paroxysmal nocturnal dyspnea. During the day, you'll notice breathlessness with activities that used to be effortless, like walking up a single flight of stairs, carrying groceries, or even getting dressed. The key difference is that this breathlessness doesn't improve quickly with rest. When healthy people get winded from exercise, they recover within a minute or two of stopping. Heart-related breathlessness lingers, sometimes taking 5 to 10 minutes to fully resolve. Dorothy used to be the kind of person who could clean her entire house in a morning and still have energy for an afternoon with her grandchildren. But over the past 4 months, she found herself exhausted by 10 in the morning, needing to sit down after simple tasks like making breakfast or folding laundry. Her family kept telling her to slow down, that she was just getting older, but Dorothy knew something was different. This wasn't the tired feeling after a busy day. This was a bone-deep exhaustion that sleep couldn't fix. When we discovered Dorothy's early heart failure and began treatment, her energy levels improved so dramatically that she felt like she had gotten her old self back. The fatigue that comes with heart failure is unlike any other kind of tiredness you've experienced. When your heart can't pump blood efficiently, every cell in your body receives less oxygen and nutrients than it needs to function properly. Think of it like trying to run your entire house on a generator that's only working at half capacity. Everything still functions, but nothing works quite as well as it should. This cellular energy shortage creates what cardiologists call cardiac fatigue, and it has very specific characteristics that distinguish it from normal tiredness. Cardiac fatigue typically hits you hardest in the morning, even after what seemed like a good night's sleep. You wake up feeling like you never rested at all. Simple activities that used to be automatic, like getting dressed or preparing meals, suddenly require conscious effort and leave you feeling drained. The fatigue gets progressively worse as the day continues, and by evening, you might feel completely depleted, even if you haven't done anything particularly strenuous. Frank stepped on his bathroom scale one Tuesday morning and couldn't believe what he saw. He had gained 8 pounds in just 2 weeks, despite eating less than usual because his appetite had been poor. He checked the scale twice, thinking it must be broken. Frank hadn't changed his diet, wasn't eating more, and certainly wasn't indulging in extra treats. Yet the numbers kept climbing. What Frank didn't realize was that his body was retaining fluid because his heart wasn't pumping efficiently enough to maintain proper circulation. When we identified his early heart failure and started treatment, Frank lost 12 pounds of excess fluid in just 10 days without changing his eating habits at all. This type of weight gain is one of the most misunderstood early signs of heart failure, and it catches people completely off guard because it seems to defy logic. When your heart can't pump blood effectively, your kidneys don't receive the signal to eliminate excess fluid from your body. Instead of being processed and eliminated as urine, this fluid accumulates in your tissues, creating what doctors call fluid retention or edema. The weight gain from heart failure has very specific characteristics that distinguish it from weight gain due to overeating or changes in metabolism. Heart failure-related weight gain happens rapidly, often 2 to 4 pounds in just a few days. It's typically accompanied by swelling in your ankles, legs, or abdomen, and you might notice that your shoes feel tighter, or your pants become snug around the waist despite eating the same amount of food. Many people also experience what feels like bloating that doesn't go away after meals. You might find yourself needing to loosen your belt by the end of the day, not because you've eaten too much, but because fluid is accumulating in your abdominal area. This fluid retention can also cause a feeling of fullness or heaviness in your chest and make it difficult to take deep breaths when lying down flat. Helen was sitting quietly reading her morning paper when her heart suddenly started racing like she had just run up a flight of stairs. The pounding was so intense she could feel it in her throat and see her shirt moving with each beat. She hadn't been exercising, wasn't stressed about anything, and had been completely relaxed just moments before. This happened 3 more times that week, each episode lasting about 10 minutes before her heart settled back to normal. Helen assumed it was just anxiety or maybe too much coffee. But when we ran tests, we discovered her heart was struggling with early failure, and these palpitations were her body's way of trying to compensate for reduced pumping efficiency. When your heart isn't working effectively, it often tries to make up for the reduced output by beating faster or with irregular rhythms. These palpitations feel different from the normal heart rate increase you might experience during exercise or excitement. Heart failure-related palpitations often occur at rest, can feel like your heart is skipping beats or fluttering, and may be accompanied by lightheadedness or a feeling of unease. The episodes typically last longer than normal palpitations and don't have an obvious trigger like physical activity or emotional stress. Many people describe the sensation as feeling like their heart is working much harder than it should be for whatever they're doing at the moment. These irregular heart rhythms develop because the heart muscle isn't getting adequate oxygen and nutrients due to poor circulation, causing the electrical system that controls your heartbeat to become unstable. James had been coughing for almost 2 months, a dry, persistent cough that seemed to come from nowhere. He tried cough drops, throat lozenges, and even antibiotics from his family doctor, thinking he had picked up some stubborn respiratory infection. But the cough wasn't getting better, and it had a strange pattern that puzzled him. It was worst when he lay down at night and first thing in the morning when he woke up. During the day, especially when he was sitting upright, the cough would almost disappear completely. What James didn't realize was that his cough had nothing to do with his lungs or throat. It was coming from his heart. When fluid builds up in your lungs due to poor heart function, it triggers a cough reflex as your body tries to clear what it perceives as an obstruction. This heart failure cough has very distinctive characteristics that separate it from respiratory infections or allergies. The cough is typically dry and non-productive, meaning you're not bringing up mucus or phlegm. It's often described as a hacking or barking sound that comes in persistent episodes rather than occasional single coughs. The timing is crucial for diagnosis because this cough is directly related to body position and fluid distribution. When you lie flat, gravity allows fluid to accumulate more easily in your lung tissue, triggering the cough reflex. This is why people with early heart failure often find themselves propping up on multiple pillows to sleep comfortably, or even sleeping in a recliner chair. The cough may also be accompanied by a feeling of chest tightness, or the sensation that you can't take a completely full breath. Martha noticed it first when she got up from her favorite reading chair to answer the phone. The room seemed to spin slightly, and she had to grip the armrest for a moment until the feeling passed. Over the next few weeks, this dizziness, when standing, became more frequent and more pronounced. Sometimes she felt lightheaded, just getting up from bed in the morning or rising from the dinner table. Martha assumed this was just part of getting older, maybe low blood pressure or dehydration. But when we examined her, we discovered that her heart wasn't able to quickly adjust its pumping to meet the demands of standing upright. This condition, called orthostatic hypotension, was an early warning sign of her developing heart failure. When you stand up, your cardiovascular system has to make rapid adjustments to maintain adequate blood flow to your brain against the pull of gravity. Your heart needs to pump a little harder and faster, and your blood vessels need to constrict slightly to maintain proper pressure. When your heart is beginning to fail, it can't make these adjustments quickly or effectively enough, causing a temporary drop in blood pressure that creates dizziness, lightheadedness, or even brief fainting spells. This type of dizziness has specific characteristics that distinguish it from other causes. It happens within the first few seconds of standing up, typically improves after 30 to 60 seconds of remaining upright, and is often worse in the morning or after prolonged sitting or lying down. You might also notice it's more pronounced when you're dehydrated, have been in a warm environment, or haven't eaten recently. Patricia had always been a sound sleeper, but over the past 3 months she found herself waking up multiple times during the night feeling like she couldn't breathe. She would sit up on the edge of her bed, gasping for air, and it would take several minutes before she felt normal again. Her husband suggested she might have developed sleep apnea, and Patricia even considered getting a sleep study done. What neither of them realized was that Patricia's sleep problems weren't happening in her throat or airways. They were coming from her heart. When fluid accumulates in the lungs due to poor heart function, lying flat allows gravity to redistribute that fluid in ways that interfere with normal breathing during sleep. This creates a condition called paroxysmal nocturnal dyspnea, and it's one of the most distinctive early signs of heart failure. The episodes typically happen between 2 and 4 hours after you fall asleep, when fluid has had time to redistribute throughout your body. You wake up with a feeling of suffocation or drowning, often accompanied by anxiety or panic, because the sensation is so frightening. Unlike sleep apnea, where breathing stops completely for short periods, this heart-related breathing difficulty involves a continuous struggle to get enough air. Many people describe it as feeling like they're drowning from the inside. The relief comes from sitting up or standing, which allows gravity to help drain the fluid away from your lung tissue. You might find yourself sleeping in a recliner or propped up on multiple pillows because lying flat has become impossible. This sleep disruption creates a cascade of problems, including daytime fatigue, difficulty concentrating, and mood changes. Now that you understand the 13 early warning signs of heart failure, the question becomes, what do you do with this knowledge? How do you move from awareness to action in a way that could genuinely save your life? Over my 3 decades of practice, I've learned that the patients who have the best outcomes are those who take a systematic approach to monitoring their symptoms and communicating effectively with their healthcare providers. Let me give you a specific 30-day plan that will help you assess your heart health and take appropriate action if needed. Start by creating what I call your heart health baseline. For the next 7 days, pay attention to how you feel during normal daily activities. Notice your energy levels throughout the day, any shortness of breath with routine tasks, and how well you sleep at night. Write down your weight first thing each morning, after using the bathroom, but before eating or drinking anything. This establishes your normal weight pattern so you can identify any sudden changes. Keep track of any episodes of dizziness, palpitations, or unusual fatigue, noting what you were doing when they occurred and how long they lasted. During week 2, focus specifically on the physical signs we've discussed. Check your ankles each evening for swelling, pressing gently on the area just above your ankle bone to see if it leaves an indentation. Monitor any cough that seems to worsen when you lie down or that persists despite trying usual remedies. Pay attention to your breathing patterns, especially whether you need extra pillows to sleep comfortably or if you wake up feeling short of breath. By week 3, you should have enough information to identify any concerning patterns.